Health has never been more important. As a healthcare partner of the government, healthcare workers, and of each Filipino family, we harness the power of science so more people can live healthier and have more fulfilling lives.
Ako po si Menard Espinosa, isang wheelchair attendant sa airport at saka isang part-time delivery rider. Siyempre, natakot ako, nag-alala ako. Bigla kagad na wala kaming pasok nung time na nag-start ng lockdown. Kaya naisip ko, nag-apply ako ng delivery rider para at least kahit pa paano meron akong source of income. Mas better na ngayon yung pamumuhay namin noong vaccinated na ako, unlike noong hindi pa ako vaccinated. Kasi nakakapagtrabaho na ako ng maayos, na walang pag-aalinlangan. Kampante ako kasi sabi sa balita, yung pagka nagpa-vaccine ka, may panlaban yung immune system mo. Magpapabooster pa rin talaga ako kahit na hindi siya required. Malaking pasasalamat ko sa mga pharmaceutical company na gumagawa ng mga vaccine kasi kundi dahil sa kanila, hindi sila makakagawa ng protection para sa mga tao.
When the pandemic started, we see that this will be long pandemic. The fact that during the time, you don't know where it's coming from, and countries are reporting lots of these spikes of cases, then it was really problematic for us to really control it without vaccine. And experience with previous pandemic like influenza, the SARS-CoV-1, that was really something that the important part of controlling the pandemic is vaccine. The problem then during the time was how can we access vaccine? And being in a third world country like the Philippines and vaccines are being made in first world country, then you know you are in the last list among those countries that will be receiving the vaccines. That's one. Second is that if vaccines are available, are they safe? Are these effective? Our experience with vaccine may not have been very good before, especially with the Dengvaxia controversy. We expect vaccine hesitancy among the population. We need to know why booster is needed. We initially thought that with the original strain of the COVID virus, achieving a herd immunity of like 70 to 80% will end the pandemic. But it's not. Virus evolved rapidly, and in fact, that evolution or mutation made it something that it's difficult to control. We see the experience when we had the Alpha variant. People are really sick. When Delta also emerged, it became so virulent that most people who got the Delta virus, higher rate of mortality. And now we have the Omicron, which is the most evasive among the variants of concern in the sense that even if you are vaccinated, your protection is not enough. So on that sense, the question is, if I am vaccinated with the 2-dose or with the primary vaccine series, will I get enough protection with these Omicron sub-variants? You have the B2, BA2, BA4, BA5. No, you're not. In fact, the data are telling us that getting the primary vaccine series will only be giving you 20 to 30% protection. So that means if you are not having the booster, then all of us are all susceptible to this infection. And that's what's happening now. People are getting sick even if they're vaccinated. Now, giving the booster is important to increase your protection against the severe form of the Omicron. And that's precisely our messaging. Why are we promoting the booster? Because we don't want you to get sick. We don't want you to get the severe form of the COVID. We don't want you to die because of COVID. And that's precisely vaccination with booster is important. The pharmaceutical industry played a major role in the control of this pandemic because they are the ones who are so innovative. They were the ones who made these vaccines. And this is the first time in our pandemic that we've seen several platforms of vaccines. You have the mRNA vaccine, you have the virus vector vaccine, inactivated vaccine, and then you have the protein-based vaccine. So on that sense, it's possible that if this pharmaceutical industry will just focus on something that will control the pandemic, it's doable. And that's why they play a major role in the control of this pandemic. Now, we're not yet off the pandemic, and we continue to have that threat of another surge of a new variants of concern that may be more evasive than Omicron, more virulent than the Delta variant, that will also cause more people to be hospitalized. Then pharmaceutical industry should continue working on interventions, not only vaccines, but also for other interventions that will really put us in a better place to control the pandemic, to prevent hospitalization, to prevent death against COVID.
AstraZeneca as an organization had a clear mission, and that was to leverage on our global presence, networking of manufacturing and regulatory capabilities to enable equitable access to the AstraZeneca COVID-19 vaccine at no profit during the pandemic. To date, we have released more than 3 billion doses of the vaccine to more than 180 countries, and 2/3 of these countries are low to middle income countries. In the Philippines, we have delivered more than 39 million vaccine doses through multilateral agreement, COVAX, and donations from other countries. We're very proud that the first vaccine to be delivered from COVAX in March 2021 was the AstraZeneca vaccine, and that supported the early vaccination at the height of the pandemic.
What does science say about the effectiveness of AstraZeneca vaccines?
We've rolled out 3 billion doses globally, and we've learned a lot in terms of how well this vaccine works in the real world. There's been a group of experts from Asia, 18 leading infectious disease experts from this region, 3 from the Philippines. Recently have put together all of that data, leveraging a group from Johns Hopkins University, which collect the data. But basically what they've done is compare how effective these vaccines are in the real world. And it demonstrates very clearly that both the AstraZeneca vaccine and either of the mRNA vaccines are giving you the same level of protection against the key clinical outcomes of COVID. That was done for the 2-dose priming schedule initially. We've just recently had a publication from Thailand, which has assessed the 3rd and 4th dose, again showing equivalent protection for both 3rd and 4th dose. And that same group that looked at the 2-dose from these Asian experts, they're also doing a revised version of that study, looking at the effectiveness of these vaccines against Omicron, because that's the world we now live in, but also the effectiveness of a 3rd dose, so first booster. And again, we're seeing very clearly that both the AstraZeneca vaccine and the mRNA vaccines are giving you very, very similar effectiveness against Omicron.
AstraZeneca vaccine is estimated to have saved more than 6.3 million lives globally, estimated to have prevented 52,224 deaths locally. This demonstrates that the AstraZeneca COVID-19 vaccine is highly effective in protecting against COVID-19's worst outcome.
In addition to human health and lives saved impact, in the Philippines, the COVID-19 vaccinations created significant and measurable economic benefits, as cited in the KPMG Vaccinations Report 2021. The mass vaccinations covering the first stages of the country's vaccine rollout actually saved $3.2 billion in healthcare costs.
So we want to save as many lives as possible. Obviously, this pandemic has affected many, many people around the world, here in the Philippines, but also globally. We want to make sure that our vaccine continues to provide a solution to keep people safe.
Through the pandemic, AstraZeneca has been at the forefront in the fight against this deadly disease. We continue to bring innovative medicines to the country, build partnership to enable holistic ecosystem solutions, and we continue to be committed to partner with both public and private sectors to ultimately help uplift standard of healthcare for every Filipino family.
I'm Ms. Delia Gayman. I am the current president of Kidney Transplant Association of the Philippines, Incorporated. I was diagnosed with proteinuria. Yung kidney ko, nag-i-emit na ng protein, yung filter niya, may mga butas-butas na. Then, noong 2020, nagkaroon ako ng heavy edema. I underwent hemodialysis for 6 months. Then after that 6 months, nakita ako ng aking anak. Sabi niya sa akin, "Ma, i-donate ko sa iyo yung aking isang kidney kasi pwede pa kaming mabuhay na iisa ang kidney namin." Doon kami nagpa-kidney transplant na 2. From then on, naging back to normal yung aking buhay. Kaya masaya ako as president of the association. Pinapakita namin, we are the living trophy of kidney transplantation. Nagkakandak kami ng kidney awareness, how to take care of your kidneys, how to prevent ESRD, and the importance of kidney donation. Kailangan natin ang early detection ng sakit. Pero dapat, bago mo ma-detect, prevent mo muna yung cause niya. Kasi sa atin ngayon, sa Pilipinas, napakahirap kasi kung medyo mahirap ka, wala kang access sa pagbili ng gamot mo. Sa amin, mga immunocompromised patient, mahalaga sa amin yung gamot na nai-improve. I'm very grateful na nandyan yung mga pharmaceutical company na gumagawa ng advanced na medicine para sa mga pasyente, sa lahat-lahat ng klase ng pasyente. Lalo na itong COVID, napakalaga, pangalagaan yung kalusugan, lalo na sa ngayon. Napaka-costly ang hospitalization.
As far as kidney disease, this is a growing concern right now. What we would like to see as physicians is to be able to identify early on who are the patients at risk to develop a kidney disease, improve public awareness of the different symptoms and signs of patients with kidney disease. And when you identify patients early on, this will actually improve your care of patients because you can actually intervene with different drugs and probably identify them, get a specific measures, invest in strengthening and equipping the health services surrounding patients with such a disease. And therefore, you can actually prevent patients from getting into the dialysis center. I think one of the drawbacks is that almost out of the 90 million Filipinos, many do not get access to health care and to the drugs itself. And this is actually where we need to really put our metrics in. I think that's the key role of pharmaceuticals. They need to continue their scientific excellence or participation in collaboration with key opinion leaders on what are the gaps. Definitely, the pharmaceuticals have to have the so-called technology and the different pioneers in scientific research.
Managing health comes in different forms. It is unique in every country, in every community, and in every patient. AstraZeneca understands these differences and is working to make health happen through the potential of science. This goes beyond the laboratories and reaches the real world. Our goal of improving quality of life by delivering life-changing medicines is rooted in our commitment to always put patients' needs and well-being first. Beyond our medicines, we also focus on collaboration and work with partners across both public and private sectors to enable a holistic healthcare system. We work towards a future where people have access to sustainable healthcare solutions for life-changing treatment and prevention.
With cardiovascular, renal, and metabolic diseases, or CVRM, we recognize the urgency of advancing solutions and addressing shared risk factors between these distinct but interrelated disease areas. Up to 20 million people die from CVRM diseases each year. Under this figure, chronic kidney disease alone poses a great amount of concern as the 4th leading cause of premature death in the Philippines, with impaired kidney disease as the 9th leading cause of death and disability. In 2021, hemodialysis procedure topped the procedural cases reimbursed through PhilHealth. Our aim is to protect the lives of 50 million people in the next year from the often devastating consequences of such renal and metabolic diseases, alongside with heart failure and cardiovascular diseases having 1 out of 2 patients dying within 5 years of diagnosis. With more than 25 therapies and therapy combinations in our early to late stage pipeline, we seek to bring real science and develop to combat life-threatening conditions under CVRM.
The goal to address with CVRM is the high mortality rate caused by diseases like diabetes, chronic kidney disease, and heart failure. In 2021, AstraZeneca Philippines launched the initiative called Kidney Patrol, which is an online advocacy campaign that promotes disease awareness and encourage action. We also launched Act Now in partnership with different organizations for diabetes, chronic kidney disease, and heart failure. This initiative promotes education, comprehensive disease management, and access to tools for early screening.
Early diagnosis is difficult in patients with respiratory diseases because everybody is actually exposed to the same environmental issues.
Building on a 50-year heritage in respiratory care, our ambition is to transform the treatment of asthma and chronic obstructive pulmonary disease or COPD by driving earlier biology-led treatment, eliminating preventable asthma attacks, and removing COPD as a top 3 leading cause of death in the world. According to the World Health Organization or WHO, 12% of Philippine population of 90 million have asthma. And according to the Global Asthma Report, approximately 11 million or 1 out of 10 Filipinos are suffering from asthma. Yet, 98% of Filipino asthma patients continue to lack proper treatment. According to the Global Asthma Report 2018, Philippines ranks second in asthma mortality rates in the world.
Since 2019, AstraZeneca Philippines has launched One Healthy Lung campaign, and this initiative promotes better disease management. To date, we have educated more than 20,000 physicians, 10,000 pharmacists, and hundreds of thousands of patients through various online platforms.
Working within a health system is important in early diagnosis of cancer. If you're talking of early diagnosis, you need to have clinical pathways, clinical guidelines that will identify our patients earlier.
In AstraZeneca, we put together innovations based on research and development and follow the science to understand cancer complexities, provide cures in its every form: lung, breast, ovarian, blood, prostate, liver, pancreatic, and cervical.
Cancer is the leading cause of death worldwide. In fact, about 10 million cancer patients die every year. And so globally, our bold ambition in AstraZeneca is to eliminate cancer as a cause of death. This is supported by our research and development. In the Philippines, we launched the Lung Ambition Alliance, which promotes early detection of cancer using artificial intelligence. And we hope that with this initiative, somehow we bring ourselves closer to achieve curative intent for this deadly disease. We also enabled partnership funding options for cancer patients and caregivers. At the height of the pandemic, we also provided hotline support for cancer patients when access to healthcare was extremely difficult. And regularly, we provide the latest scientific updates to physicians and multidisciplinary teams in cancer institutions.
I think we need to mention that each of these has a role in the control of the pandemic. The government see to it that policies in terms of health protocol, vaccination, and protecting the population is a priority. The healthcare workers are those part of this pandemic because they are the ones who will take care of the patients, those who will be hospitalized. While the pharmaceutical company are the ones who will be producing the vaccines, producing innovative interventions to decrease people from getting the infections, like monoclonal antibodies, antiviral agents. So all of this, they have a unified goal of protecting the population against the infection, protecting the population in getting the more severe form of the infection. And more or less, the goal is how can we live and how to survive this pandemic and continue with our daily life. And that is really an important part of this pandemic, that all of these three should work hand in hand in order to survive, in order to continue with our life.
We truly support the universal healthcare program if it is able to deliver healthcare all the way to everybody, no matter what gender, no matter what sector of society you have access to high quality health care. We need to have a healthcare system that have equitable access to a comprehensive, community-based, innovative, is something that is culturally competent healthcare service that is reachable for everyone.
Our medicines have reached and touched the lives of millions of Filipinos, so we ensure that we continually push the boundaries of science to deliver life-changing medicines. As the leading pharmaceutical company on the number of clinical trials conducted in the Philippines between 2019 to 2021, we will continue to provide high-quality, innovative medicines and be consistent in offering physicians the opportunity to constantly improve patient care.
As the first Filipino country president of AstraZeneca Philippines, I am very proud of our team's contribution to the Philippines' recovery from this deadly virus. AstraZeneca has been at the forefront in the fight against this pandemic. We will continue to bring innovative medicines to this country, and we truly stay committed to build partnership and enable holistic ecosystem solutions for a more resilient healthcare system. The mission of uplifting the standard of healthcare for every Filipino family is very close to my heart. The AstraZeneca Philippines team, together with me, is committed to always put the Filipino patients at the center of everything that we do.